Headphones on?
Welcome everyone. My name is Craig Spencer. I'm the audiology team lead for Widex in Canada, and we welcome you to another podcast on tinnitus. Today we're going to be talking specifically about tinnitus and mental health and how to broach this topic with patients. I'm joined again by Dany Pineault. So thanks again, Dany, for joining us.
Thank you for having me again.
Dany is a clinician with a wealth of experience, over 25 years, working with tinnitus patients. He works clinically. He's worked in both private and non-profit businesses. He is an adjunct professor at A.T. Still University's Arizona School of Health Sciences, and he has a passion for educating students on the topic of tinnitus, hyperacusis, evaluation and management, and also the relationship between age-related hearing loss and cognitive decline. So welcome again, Dany.
Well, Greg, thank you again for the great introduction. Listen, it's been my absolute pleasure to join you on the podcast and be part of these educational discussions on tinnitus. So today I'm excited to continue exploring the connection between mental health and tinnitus and sharing some valuable insights I've gained over the years from conversations with patients on this particular subject.
For sure. Well, again, we're happy to have you. So, but before we get into the details about how to broach this topic from patients, maybe we want to just go over the association between mental health and tinnitus again.
Absolutely. The relationship between tinnitus and mental health is really well established, as you know. But before we dive into the association, let's take a moment to talk about the concept of mental health. Okay?
Sure.
Just like physical health, mental health can change or evolve over time and is influenced by a variety of factors, including life events, genetic predispositions, chronic health conditions, trauma, substance use, and childhood experiences, and so on. Okay? Mental health issues can affect individuals of all ages, education, income levels, and cultural backgrounds. In Canada, it is estimated that approximately 1 in 5 individuals will encounter a mental health condition or conditions at some stage in their lives. Okay. It's important for clinicians to understand that a mental health condition can significantly or profoundly impact our cognitive, emotional, and behavioral well-being, and ultimately affecting the way we think, the way we manage and control our emotions, and the way we interact with our surroundings or environments. And lastly, I would say that common signs of poor mental health include excessive fear and worry, persistent feelings of sadness and hopelessness, increased irritability, stress, and mood swing, challenges with our concentration and making decisions, sleep problems or disturbances, and chronic fatigue, increased use in substances such as alcohol and drugs, social isolation, and thought of self-harm and suicide.
Mm-hmm. Yeah. So to get into the association again between mental health and tinnitus specifically, which conditions are most commonly associated with bothersome tinnitus?
Yes, so bothersome tinnitus is most frequently associated with anxiety disorders, depression, post-traumatic stress disorder or PTSD, and sleep disorders.
Okay, and then would you be comfortable kind of taking us through those specifically?
Yes,
yeah.
So let's start with anxiety disorders, including generalized anxiety disorders, health anxiety, social anxiety, obsessive compulsive disorders. So anxiety disorders are characterized by an overwhelming feeling of fear and worry, often centered around a specific subject or topic, often centered around health, having a serious medical condition, or centered around a future life event, or centered around a social situation or challenges at work or financial difficulties, name it, right? What's fascinating between the connection between tinnitus and anxiety disorders is that tinnitus can worsen anxiety disorders, while anxiety disorder itself can significantly influence how tinnitus is perceived and experienced. And we'll revisit this topic a little later in the episode, okay? So it is estimated, I think that's very interesting, it is estimated that about 30 to 40% of individuals with tinnitus also experience an anxiety disorder. Now, depression is characterized by persistent feelings of sadness and hopelessness, sleep disturbances, low energy, chronic fatigue, loss of interest, and so on. Right? Once again, tinnitus can worsen depressive symptoms, and depression itself can exacerbate tinnitus-related distress. Now let's kind of explore the intricate relationship between tinnitus and post-traumatic stress disorders, or PTSD. Right. Okay, first, PTSD refers to a severe distress linked to traumatic experiences. Right. Okay, so on one hand, tinnitus can trigger distressing and traumatic memories, which is going to worsen PTSD symptoms. And PTSD itself can not only amplify or intensify the perception of tinnitus, but also exacerbate tinnitus-related distress. So interestingly, veterans and members of the military, including soldiers and medics, are at an increased risk of developing both tinnitus and PTSD due to their heightened exposure to loud noises in combat situations. So although we don't have an exact number for the prevalence of individuals with both tinnitus and PTSD, research indicates or suggests that a large portion of military personnel with PTSD also have tinnitus. With tinnitus also have PTSD. So lastly, sleep disorders, including insomnia, sleep apnea, restless leg syndrome, and circadian rhythm disturbances, your jet lag condition, okay? So they're all characterized by disruption in sleep patterns in both quality and quantity of sleep. Now, everybody knows that tinnitus interferes with sleep, right? Sure. Contributing to higher prevalence of sleep disorders among the tinnitus population, ranging from 40 to 70%, as compared to 10 to 15% in the general population.
Right. So would it be safe to say, or accurate to say, that there's almost a bidirectional relationship or association between these conditions and tinnitus? It's like they kind of influence each other?
Indeed, there's a bidirectional association, or a two-way street between tinnitus and bothersome tinnitus. So on one hand, tinnitus can significantly impact an individual's cognitive, emotional, behavioral well-being in several ways. As we discussed in episode 1 and 2, the constant presence of tinnitus can result in increased irritability, stress, sleep problems, diminished concentration, and so on, right? On the other hand, poor emotional and behavioral well-being can also have a profound influence on tinnitus perception and experience. So individuals with anxiety disorders often experience hypervigilance, a state of hypervigilance, which heightens their sensory perception. So this increased awareness does not only extend to their surrounding, but also to their own bodily sensation, including heartbeats, breathing rates, pain, aches, and tinnitus, right? Mm-hmm. Unfortunately, many patients tend to attribute their emotional and behavioral challenges solely onto their tinnitus, sort of ignoring or overlooking the role of their own mental health as a contributing factor. Often they believe that if tinnitus just disappeared, like these issues would go away. But determining which condition comes first, the chicken and egg condition is not always feasible. As a matter of fact, research suggests that both conditions mutually influence each other. Okay? So it's important to highlight here that only relying on hearing care interventions for patients who've been identified as having potential emotional and behavioral challenges during the well-being screening or the Access 3 of our comprehensive assessment, remember, with
yes.
podcast 2. So only relying on hearing care intervention for these patients might not lead to favorable treatment outcomes.
Right.
Yeah.
Okay, so if, let's say an HCP suspects that a patient may have a mental health condition, and that's kind of part of the puzzle with their tinnitus situation, how do you suggest they begin broaching that topic with the patient?
Yes, first and foremost, a clinician must be aware that despite the remarkable progress made in reshaping perceptions of mental health over the last few decades, the stigma surrounding mental illnesses is still widespread. So clinicians must approach the topic with great sensitivity, care, and understanding. You see, many patients and even fellow clinicians may still hold on to outdated beliefs and views around mental health. So it's essential, it's critical to provide patients with a safe and welcoming environment. You see, when patients feel comfortable and free from judgment from clinicians, they're more likely to openly discuss their tinnitus-related distress, to be receptive to the connection between tinnitus and mental health, and even willing to consider exploring useful strategies such as stress management or even counseling. Additionally, clinicians need to be mindful of the language they use while having this conversation with patients. So using a sensitive terminology helps establish greater environment, safer space, reduce stigma, and encourage open dialogues between clinicians and patients. So clinicians really want to stay away, really want to avoid terms such as mental illnesses or poor mental health or psychological condition or psychiatric disorders. And instead they want to focus the conversation around concept of cognitive, emotional, behavioral well-being, as these terms are less likely to trigger any distress from the patient.
You mentioned counseling strategies.
Yeah.
Can we maybe get into some of the more specific counseling strategies that an HCP could employ in this type of discussion?
Yes, so to illustrate how to approach the topic of mental health with patients, you and I are going to do something a little different, okay? We're going to participate into a little role play activity.
Sounds good.
Okay, so in this scenario, I'll be the clinician and you'll be the patient, okay?
Sure.
So, Greg, imagine that you've been dealing with a subjective tinnitus, bothersome tinnitus for over a year, okay? In addition to the chronic ringing in the ears and the challenges you've encountered understanding speech in noisy environments, you also struggle with some emotional and behavioral issues, such as you're more irritable, your stress has increased, you're not sleeping very well, and there's some challenges with your concentration. Now, to make matters worse, you were told at your last performance appraisal that your performance did not meet the standard as set in the previous year.
At work, yeah.
At work, yeah. So understandably, you're feeling quite overwhelmed, okay?
Sure.
So I'll be asking you questions related to mental health, and you'll be sharing with the audience how it felt to be on the receiving end of that.
Sounds good.
Yeah? Okay. So to begin, let's explore the first counseling strategy I call the Wellbeing inquiry. Okay? So, Mr. Spencer, in addition to the physical discomfort of having this chronic ringing in the ears, it's important to also consider how tinnitus might be affecting your well-being. So can you share how your sleep, your concentration, your stress level, even your work has been influenced by your tinnitus?
Yeah, I mean, the tinnitus is bothersome. I find I'm more stressed as a result of it. It's making it harder to fall asleep. When I do wake up at night, I hear it. And then by the time I get to work in the morning, I'm already feeling drained. It's affecting my ability to concentrate. And yeah, I mean, as much as I don't want to admit it, it probably is affecting my performance at work.
Now I'm wondering, did you perceive the question as insensitive or as judgmental?
Not at all. It just felt like you were genuinely interested in how this was affecting my life.
And did you feel encouraged to maybe explore the broader impact of tinnitus?
Absolutely, yeah.
Okay.
It felt like for the first time, someone was really interested in uncovering how this was affecting me.
Great. Okay, so let's move on.
Sure.
Let's explore the second counseling strategy I refer to as normalizing the emotional and behavioral responses to tinnitus, okay? Mr. Spencer.
Yes.
Did you know that many folks with tinnitus not only struggle with physical symptoms and hearing difficulties, but also emotional challenges? It's quite common for folks with bothersome tinnitus to experience a lot of stress, to feel tired because they're not sleeping as well, to feel they're not performing as well at work because of concentration difficulty and so on. So can you share some thoughts, feelings, or reactions you've experienced because of your tinnitus?
I mean, you kind of just summarized it in many ways. Like I'm one of those people, it seems, where it's causing me stress, it's affecting my sleep, and that is then causing issues with my overall kind of mental well-being, for sure.
And once again, did you perceive the question as judgmental or?
Not at all.
So did you think it was reassuring to know that you were, like it's quite common to feel that way?
Absolutely. It makes me feel like I'm not alone.
No, exactly. So then let's explore the third counseling strategy, which I call the educational approach. Okay? So as you're aware, Mr. Spencer, tinnitus can affect our well-being.
Of course.
What's intriguing, however, is that research indicates that the connection between tinnitus and well-being works both ways. So the way you think and the way you feel about tinnitus can often influence the perception and the experience of tinnitus. Okay, so when you feel super stressed or angry, so your tinnitus can seem probably louder and certainly more intrusive.
Yeah.
So how did it feel to learn about the bidirectional association between tinnitus and mental health?
I think it felt good to have that connection or that pattern that I've noticed kind of be validated. Like there's a reason why I've found that the tinnitus stresses me out and the stress seems to make things worse. I just thought it was me, to be honest.
Kind of give you some answers to some questions you had. Right?
Yeah.
Did you think it was a suitable way to learn about this association?
I think so.
Yeah?
Yeah.
Okay. Well, let's explore the last counseling strategy, the fourth one, which I call the effective coping strategies. So given the impact of tinnitus on your stress levels, Mr. Spencer, on your sleep, on your concentration, even work, have you ever thought of exploring some stress management techniques, such as deep breathing, relaxation, mindfulness, meditation, even counseling?
Not necessarily, but after knowing what I know now, I'd be open to the idea.
Yeah?
Yeah.
If you are open, I could provide you with a list of resources and even connect you with experts that could really help you manage those issues a little bit better.
Yeah, I'd be open to that.
So once again, how did you feel?
Just fine. I
Just
felt like
fine.
you were being attentive to my situation again, but you were offering me like hope in a way. That these things can help, and that there's experts and there's strategies out there that can improve the situation.
Did you perceive I was kind of pushy, trying to make you do
Not
something
at
you don't
all.
want to do? No.
No.
And you didn't feel disrespected or...
No, I mean, you weren't telling me to do anything. You were
Okay.
just kind of providing information, so.
Awesome.
All right, well, thanks again, Dany, for joining us. We hope that the information provided today is going to help some more of our customers, HCPs out there, to feel more comfortable talking about these types of things with tinnitus patients, because it really can help influence the situation in a positive way. And we look forward to your attendance at a future Widex podcast.
Thank you.
Thanks.